Great. Good morning still. Thank you for coming. What I noticed was that between the two speakers, there was a change in age in this room already. Went from people who are interested in kids, and now I see a slightly older group. But it's too bad, because those young people, they should have stayed, because it's the key for them to get to be a successful ager. They needed to actually listen to this and sleep. So my name is Phyllis Sze. I direct the Sleep Disorder Center and the Center for Circadian Medicine and Biology at Northwestern University in Chicago. One of the areas I've been really interested, among many things, has been looking at successful aging. You know, what is the keys to successful aging? We, of course, think about nutrition, right? Exercise, and sleep. So sleep ends up being, in my opinion, the pillar of all of this, because when you sleep well, you're more likely to exercise because you have more energy. I would say, if you don't eat well, you may not be able to sleep well, and vice versa. And sleep, as you may have already heard, affects your appetite regulation. If you don't get enough sleep, you may actually have more risk for diabetes and so forth. So I think sleep is going to be really important. What I want to talk about today is mainly about cognition and neurodegeneration. I would say one of the greatest things, and these are some of my disclosures. Nothing of my conflicts of interest today would really impact what I say today. So why did I become interested in aging research? Well, this is the number of the population in the US in 1990, right? Now look at what happens in 2000, I can't see because I'm getting old, 2010. What's happening? Look at the young people, and look at the old people up there. I just go one more place. And this is what we expect to be in 2030, which is just a few years from now. So not only are Americans getting fatter in their waist, but the demographics of age has totally changed, so that there's going to be more and more older people at the top. Before, it was like a triangle. Now, it's like a rectangle. And I would argue that on the face of this earth, not in the universe, just on this earth, has never experienced so many old people, older adults, ever in the history of mankind or womankind, right? And so there's a huge challenge here. So how do we keep ourselves healthy? How do we keep ourselves productive throughout this age? So the new old is really much older. I thought 65 was old. I just turned 65, and I thought, hey, I feel like I'm 30 years old. So we have a lot more to live. Now look, if that were the case, if nearly more than 50% of our population is going to be over the age of 65 in 2030, 2040, look at how many people with older adults have sleep problems. Nearly 65%, nearly 60% of people over the age of 65 are going to have sleep disturbances. I don't mean insomnia. I just mean any type of sleep disturbance, including sleep apnea, restless legs, and so forth. And the most common change in older adults is that of sleep insomnia. So older adults have more problem falling asleep, but different than younger people, they have more problems staying asleep as well. How many of you kind of wake up in the middle of the night, have to go to the bathroom? You didn't do that when you were like 16, right? Unless you were drinking. So this becomes a big issue. If indeed sleep is that important, and so many Americans and so many Canadians and basically everybody in the world is going to get older, and we hope that that is the case, I think sleep is going to be key to this healthy aging. So because the impact of poor sleep is huge. Increases the risk of falls. What's the scariest thing that older people get? I don't want to fall, right? Because you know that's going to increase your risk of poor health. There's shorter survival that's been associated with inadequate amounts of sleep. Pain. If you're already in pain, if you don't sleep well, it actually decreases or your threshold for pain. You're more likely to have pain. So all of these are bidirectional relationships. Cardiovascular risk, diabetes, all that can increase just because you're not getting enough sleep. And of course, difficulty concentration. And we'll talk a little bit about healthy aging, and we'll talk a little bit also about abnormal aging, especially as it relates to the brain, because I'm a neurologist. There's many other possibilities. So why is this the case? Why do older people get more sleep problems? Well, it could be because as you get older, your brain gets older, and the areas that regulate your brain are aging as well, and you may not be able to just naturally sleep as well as you did before. And then that can result, of course, in sleep loss. However, there are other conditions. As you get older, you have more medical conditions, you have more psychiatric conditions, depression, for example, and not to mention you have to get up to go to the bathroom, right? That's called nocturia. And there's also late life psychosocial factors, bereavement, loss of family, and also retirement. I mean, that all changes our lifestyle, and all of these could be contributing to poor sleep. So let me just show you one thing about just normal aging and why that could increase the risk for sleep disorders. And I wanted to show these arrows in both directions because they're bidirectional. One can affect each other. So as you get older, a couple of things happen. This is the brain, and you think that sleep is just for the brain to keep you awake? Sleep. The brain sleep transmits this information down to every tissue in your body. Every tissue in your body. When you don't sleep, your muscle remembers that you didn't sleep. It changes the metabolic activity. It causes higher inflammation. So sleep isn't just for the brain, it is of the brain, but it's really for the rest of the body. So one of the things that keeps us in a good circadian time, and helps with our sleep is the fact that we get light. As you get older, you get cataracts. You have other types of things where you may not be as sensitive to light. Or you're just staying indoors. But Vancouver is really nice. I mean, you're like all these windows. But if you're in Chicago, it's actually fairly dark. And if you're in a nursing home or an assisted living facility, it could be even darker than that. Physical activity levels go down. You're also no longer working, for example, so your social structure is also changing, and all of these things can affect the quality of your sleep. So now I'm telling you a little bit about what you can do, right? All these things go down, so what you can do to improve your sleep is to kind of move all these things up eventually. Well, but on the other hand, you can't do a whole lot if your brain just ages a little bit and your sleep is just poor because you're old, right? But what we now know is great news, is that most of the sleep problems, not just because your brain got a little older, which is fine, is because of the medical, psychiatric conditions. So that means diabetes, heart disease, depression, nocturia, chronic pain, sleep disorders. All of these are contributing to the high prevalence of sleep problems, which means that these are modifiable risk factors. These are things that we can do something about and treat. And indeed, this is a data which is very nice. It shows that older adults with insomnia, if you look any sleep complaint in the green, that means all older people. It's 60%, like I showed you before, have insomnia problems. If you now look at the healthiest in the yellow, much lower, almost like young people. So it's important to stay healthy, right? And to kind of protect your sleep, but also when you don't sleep, it's a risk factor for not being able to be healthy. So the bottom line here is from all the work, you can kind of summarize over here. Normal age is associated with some changes in sleep and circadian rhythms. Your deep sleep does go down a bit, but it's not primarily responsible for the very high prevalence of sleep disturbances. Indeed, it's all these other things that you can do something about, increasing your physical activity level, getting more light during the day, and eating well, right? So the good news for all of us is that bad sleep is common, but it's not an inevitable part of aging, right? So this is a good news that we can move forward with. And indeed, it's a bidirectional relationship. Poor sleep affects poor health. Poor health affects poor sleep. But you go like, oh, aging. But I would argue that aging is the only way I know to live a long life. So let's get on with it. So now let's look at pathological aging, Alzheimer's disease. We've been able to pretty much manipulate and be able to live past our cardiovascular disease, which was really one of the early killers and that created morbidity as we got older. But now, as part of that, because we're healthier, we're living longer, now we have the brain, the Alzheimer's, the cognitive impairment, and this is indeed, I think, one of the future and certainly current frontiers that we are so concerned about, because how do we care for this? And I'm going to show you why sleep is important in this. This is a little watch. I don't know if you guys have worn like a Fitbit. How many have Fitbits or things of that sort? Yeah, there you go. So this is like a super Fitbit right over here of 1 week's activity across the 24 hours. The little dark lines are basically when you're moving, and when you're not moving is the line is a white part. And you can see that you're supposed to be sleeping where it's kind of light with little movement. But in a patient who's older person, and especially one with Alzheimer's disease, what do we see? Lots of movement during the night, right? Tons of movement during the night. Right over there in the middle, lots of movement during the night. So that we call sleep fragmentation. This is not just insomnia. This is what we call irregular sleep-wake rhythm. They sleep during the night, on and off, on and off. They also sleep during the day, on and off, on and off. So this whole kind of multiple napping behavior. So this is very typical of pathological aging. You go like, who cares? This is data. You guys don't have to read all this, but I just want to show you that what this data shows is that if you have poor sleep, 10 years before, this is 25,000 people, they followed them for 10 years, almost, 9.5 years, and they found that they had sleep problems, sleep fragmentation like the one that I showed you. They don't have dementia. They don't have Alzheimer's disease. At that time, it was a risk factor. Bad sleep was a risk factor for getting, for the higher likelihood of having dementia and Alzheimer's disease 10 years later. Okay, in older adults. Now, that doesn't say that if you sleep better, you're not going to get Alzheimer's disease, but hey, I think this is pretty good, that I would be worried about that, and I would try to get as good sleep as I possibly could. So you might say, why is that? Why would sleep do this? Well, this is a beautiful picture from one of my colleagues. How many of you have heard about Alzheimer's disease and A-beta amyloid? That amyloid is what's accumulating in the brain of people with Alzheimer's. Well, that's what's happening, right? So now what sleep does is that sleep decreases the production of A-beta amyloid, which is this toxic substance that builds up in your brain that can cause Alzheimer's disease. And also, it not only decreases the production, it also flushes it out. It's almost like you take a bath. Your brain takes a bath during sleep and flushes these molecules out. So it prevents this accumulation. And so it could be, you could be sleep deprived, and this can happen, just not getting enough sleep, or your sleep is fragmented because of disease, or you have other sleep disorders like restless leg syndrome or insomnia, or for that matter, sleep apnea. Sleep apnea has also been associated with Alzheimer's disease. So really, so then you're like, well, why is that? So I used to think, I'm a neurologist, I said, well, if you have a neurodegenerative disorder like Alzheimer's disease, you get all these neurotoxins that build up in your brain, you get this beta amyloid, and that also disrupts sleep. But what the data now is showing is that it's bidirectional. It's really that if you disrupt sleep, you also increase these toxic molecules, and by increasing those toxic molecules, it can predispose you or increase your risk for having Alzheimer's disease. What about Parkinson's disease? Some of you are interested in Parkinson's disease. Well, it's another neurodegenerative disorder. It's not all that different in some ways, but it's a different part of the brain that is having this neurodegeneration. We all know that there are motor symptoms of Parkinson's disease. There's problems with walking, there's problems with rhythm, and there's also a tremor. So we tend to think of that as Parkinson's disease. However, if you look at what we call the non-motor symptoms of Parkinson's disease, sleepiness is one of the biggest ones. People fall asleep during the day. They almost become, some people think they're almost like narcoleptic. They can fall asleep during the day. And their sleep is also disrupted during the night, right? So it's bad both ways. And it's one of the most debilitating factors, other than the fact that that their movements are altered in people with Parkinson's disease. So you go like, why do they have it? Is it because they're on medications that can make them sleepy? So actually one of my, who was a former student, did a really, really nice study and showed that the people who were sleepy actually also had very poor sleep. But here's something that's very cool. So he said, why don't we increase light exposure? Remember, older people get less light exposure during the day. So he just gave them like a fairly bright light, probably a little brighter than what is out there today, about 10,000 lux. And what he saw, the ESS is just a measure of daytime sleepiness. It's called the Epworth Sleepiness Scale. So when the number is high, it's more sleepy. When the number is low, it's less sleepy. Look what happened. So there was a change. So in the bright light, just getting bright light during the day improved their level of sleepiness in these people with Parkinson's disease without drugs, okay, without extra medications, no stimulant medication. And this is a very large effect size that is very close, that any drug, most drugs can't even give you that much of a different score. But it not only improved the level of sleepiness or decreased sleepiness, it decreased sleep fragmentation. It consolidated sleep. Just having light during the day, it decreased the time to fall asleep. And these people with Parkinson's disease were more active. They were physically more active during the day, just from the light. And this was only a 2-week study. And right now, Alex Vidanovic has got an NIH grant to be able to look at this in a longer term and do a real trial with light therapy. So we can kind of think about sleep and circadian rhythms. They interact, and they change not just the way how well you feel right now and how awake you are during the day, but they're altering your neurological function, your brains, your neuron function. It's also changing your metabolism, so your glucose and your insulin are also better regulated. And through that mechanism, through inflammation, it may very well be contributing to the risk of cardiovascular, metabolic, and neurological disorders. But it's a bidirectional relationship, as you can see. So today, the data in the last maybe decade or so has really shown that these circadian rhythms and sleep are essential, not just for you to be awake right now, but essential for your cell function in every tissue of your body. And that sleep disruption can actually contribute to this cardiometabolic and neurological disorders are very common as one gets older. And therefore, if that's the case, then improving sleep and circadian rhythms can be targets for prevention and disease modification. And this is exactly why I'm so excited to be here with you, because I'm thinking, and we're doing work in this area, is how do we move this along? How can we take 50-year-olds, 40-year-olds, or high schoolers and get them to embrace that sleep is really important, really for successful aging, but it's also never too late, right? It's never too late to be able to do that. So what can we do? We can use drugs, we can use pharmacology. Well, that has side effects. I'm going to move, yes you can, but I'm going to move away from that because you use bright light therapy. We talked about that. This is a room in the assisted living facility that we have, and this woman is what I call a light junkie. She goes in, after we stopped the study, she still went in there and turned those lights on because she thought it was really, really helpful for her. We can do exercise, timed exercise, regularity, have regular light exposure, regular timing of your exercise. It could just be walking. It doesn't have to be vigorous exercise, right? And also meal timing. Don't eat within 2 to 3 hours of going to bed, right? Do not eat. Have a nice overnight fast of at least maybe 10 to maybe 12 hours. That means from the moment you stop eating at night to the next day, keep that fast. Don't eat in the middle of the night, because that also can help you with your sleep, okay? So these are very important things. Of course, don't drink a lot of fluids. Another method that we have just done, and it's very early in the game, but I want to give you some new stuff, is how can we enhance deep sleep? When you get older, your deep sleep goes down. A baby, you can move them around, they have lots of deep sleep. You throw them around, they go right back to sleep. Try doing that to an older person, right? Now, they get up and they go to the bathroom and they can't get back to sleep. So how can we enhance that deep sleep without using drugs and pharmacology? So we're thinking if you can enhance deep sleep, we can do a lot of good to all of these disorders, whether it's cognition, metabolism, mood, etc. You can do exercise, as I said earlier. You can do pharmacology. We can do light. And I'm going to talk a little bit about neural stimulation. So we have been using sounds. That's a little sound. You don't have to be in this cap. So while you're sleeping, this little pink noise comes into your ear. It sounds like this. Shh, shh, shh. All right? That's pink noise. And it stimulates from that your own brain waves to be bigger, higher, and deeper and longer. And when we do that, we have been able to show that we change your heart rate variability. We make your heart rate during the night, during sleep, calmer, just like you would expect, what we call a higher parasympathetic activation. So that's good. That's all good because it also helps regulate your heart rhythm, your heart rate. We also know that it increases deep sleep by doing that. Even more, increases deep sleep. So there, oops, I have little problems there. And we also have shown that increases cognition. These older adults, normal older adults, who we gave them 88 word pairs to remember before they went to sleep. They learned it. And then sleep itself can consolidate memory. And then what we then did was we said, how many can you remember the next morning, the next day? They remember almost 30% more with this kind of sound stimulation during the night. Sleep itself improves memory, but this is in addition to the sleep itself. It's very new technology. I do have to tell you that Northwestern has a patent on this technology at this point, but it's really, we're just doing research with it. So we believe that by stimulating deep sleep, we can improve the autonomic functioning, your heart rate variability, your deep sleep, and through that system, and when you're doing better from a cognitive standpoint, you're doing better from a cardiovascular standpoint, that also feeds back to the brain to create even more deep sleep. So I think this is, so people here at this convention are definitely working on new methods of improving sleep, both in young, but of course in older adults. So I'm going to leave you with this last thought. So healthy aging is associated with changes in sleep, but aging itself does not explain the high prevalence of sleep problems, but rather it's probably the cardiovascular, the health risks of really getting yourself in better health can also help with sleep. Poor sleep is not an inevitable part of aging, so that's good. Healthy older adults sleep well, and those who sleep well are likely to be more healthy. There are treatments, there are approaches that we can use that includes light, physical activity, good nutrition, that we can try to stave off this Alzheimer's. We can try to stave off this neurodegeneration. It is a race against time, however, but we're going to try to delay that and get us into successful aging for as long as we can. And that's the last thing. It's never too late, right? Look at this young lady here. It says, if you worry about growing old, don't lose sleep over it. Thank you very much. Yes?
You mentioned this sound, is this waterfall? music or stuff, is that the same effect?
So the question is the sound like waterfall? It is. It is very much, it's like shh. It is, pink noise is 1 over frequency, so it's like white noise, but a certain fixed 1 over the frequency of white noise. Yes, but this is special, only in the sense that it only helps you if you're already going into sleep. So you got to be asleep, and our algorithm knows when you're falling asleep, when it's already in deep sleep, and it puts this little sound right at each of these deep waves and enhances it. Now, that's not to say that maybe just pink noise isn't going to be helpful. We haven't done those studies. But it's just to give you an idea of kind of the coolness, right? The potential of what we can do as we get older, and how can we try to create countermeasures so that we can stay our brain healthy. And there are some units out there, not from us, but from other companies, that they say that they can do, pink noise. So something to look at. There's a lady over, yes, at the microphone.
I was just wondering,
please go to the microphone if you can.
Thank you. So I find as I get older, I find it hard at changing time zones. So coming back from a different time zone, it takes me a while to get back into that frame of mind again. And I also heard that somewhere I read that you can actually, one of the things you can do is go camping, and you get the natural light, and then you get back into your regular.
Yeah, so this is great. So it depends which direction you're traveling. As you get older, your clock rhythm gets a little earlier, okay, and a little shorter. So it's going to be easier. In fact, for you to go to Europe, but it's going to be harder for you to come back to the US, all right? Because it's going to take longer. A young person, easy to come back, because when you go to Europe, you have to advance your clock, whereas if you come back. So it does depend on the direction. Can you go camping? Certainly young kids should go camping, yes, because what's happening is that we're losing this prominent time giver, which is the light-dark cycle. And by going camping, that's basically what we're doing. We're living in a natural light, very bright light during the day, and fairly dim moonlight during the night. So getting more light during the day actually helps prevent some of the negative effects I just heard about from the previous speaker about all these light at night things, these little gadgets and everything, that's bad. However, if you got more light and more physical activity during the day, it's protective against many of these adverse effects. Yes, sir?
Would you speculate the new technology with the noise, that it may be effective in elderly people, middle-aged elderly people that don't have neurodegenerative disorder, but have significant sleep maintenance problems?
Yeah, so will it help people who don't have neurodegenerative disorders? This is not we did this in very normal older people who were not that, and they did not have insomnia. So I don't know the answer to you to that, whether we can treat certain disorders like sleep maintenance, insomnia, or problems, but we hope so. I mean, that's kind of the future, just to give you a little thing into like what's coming down the pipeline, hopefully, and the excitement in that area. Yes, sir.
Hi.
And I have to cut out, because unless you want to stay, because it's lunchtime anyways.
I'm wondering about anticholinergic drugs in over-the-counter medicine,
Yeah.
something like Advil nighttime,
Right.
and whether someone with dementia should be taking any
No.
of that?
The answer is no.
And what about someone in middle age?
The answer is still no. I think if you take it intermittently, all of these antihistamines, so-called antihistamines, are really anticholinergic. You're absolutely right. And that can decrease cognition. It has a very long half-life. You get drowsy during the day as well. So if you're drowsy during the day, you're napping, you're not going to even be able to sleep even less well during the night. It does affect your cognition. Intermittently, if you have 1 or 2 days, that's okay, but it's a chronic use. We recommend against it. I certainly would recommend against that, especially in older people. There's also the increased risk of falls with these medications.
Okay, thank you.
Thank you. I've been told I have to stop, but I'll be happy to answer your questions outside.